The COVID-19 pandemic hit Siouxland hard, especially those in the medical profession. But as Stephanie Johnson explains, those at the intersection of the Black community and healthcare faced even more challenges.
Remember walking into this room, looked into that patient's eyes equally. Oh, my dear Lord. I saw fear. I saw terror, so to speak, in the eyes of that patient.
Dr. Patrick Obin truly believes he has the gift of touch.
Number one, he doesn't see my face. Number two, I'm speaking through layers of PPE. I've got an accent. He's now worried, is he going to understand what I'm talking about? I looked into his eyes, I saw he was terrified. I walked towards him, put my hands on his shoulders, looked into his eyes, and told him, I've looked at your numbers, just the usual patient encounter. I'm not concerned about you. We are learning what this COVID thing is, but I'm not so concerned about you. I'm your doctor, I'll be here for you. I don't want you to be afraid. And you could feel the atmosphere of the room changing. This guy was relieved. I came to realize that touch, just touching him and being there for him, was better than all the medications I could ever prescribe for him.
Wearing full personal protection equipment, or PPE, every day created a barrier between doctors and patients. This pandemic has taken a toll on many of those working on the front lines.
You take those feelings home with you, which is hard to do because you want to just leave your emotions at the door and not take it home to your family. And the hardest thing now, thankfully, you can have a visitor, but not having visitors, I'm getting emotional, sorry, just having the family come up to the window and just putting their hand on the door and not being able to touch them, that just hits really hard to home.
But hope was on the way.
I'm confident that the vaccine is both safe and effective, and I look forward to being vaccinated as soon as the supply increases and access expands to the broader population.
And medical professionals were the first in line to get a dose of it.
The only reaction that I had both times was just a sore arm, nothing that just taking ibuprofen couldn't solve.
But with the announcement of a vaccine came a new responsibility of convincing the Black community to get it. But with history of the Tuskegee experiment and the story of Henrietta Lacks, many in the Black community are hesitant.
I do think that they know our history, and they know that we tend to not have primary care physicians. And so we all recognize, especially African Americans in medicine, recognize that Black people don't have the trust in medical community as the non-minority population.
However, an African-American woman, Dr. Kismikia Corbett, is a trailblazer behind the vaccine, and doctors are working overtime to gain the trust of Black Americans.
Just make an informed decision about taking the vaccine. Don't allow history to predicate what you're going to do in your future. Find the facts, look up the facts. If you need to, call your family physician and ask questions, but don't just take for face value some things you see on social media.
In Des Moines, Stephanie Johnson.
Martin Luther King Jr. is probably the best-known leader of the American civil rights movement, but it took 15 years to get his birthday declared a federal holiday. We'll explain who's truly behind the origins of MLK Day coming up.